What is bronchitis? Bronchitis is a type of infection that affects your lungs. It causes inflammation in the lining of your bronchial tubes. These are the tubes that carry air from your trachea, windpipe, into your lungs. Bronchitis is most often caused by viruses, usually the same ones that cause a cold or the flu, although sometimes bacteria are to blame. Some people are more prone to getting bronchitis than others. People at higher risk include those who smoke, have a weak immune system, have gastroesophageal reflux disease (GERD), work around airborne irritants such as chemical fumes or dust, live in cities or areas with high amounts of air pollution, are not vaccinated against the flu. The flu can lead to bronchitis. Symptoms of bronchitis. Symptoms of bronchitis can vary from mild to severe but usually include a nagging productive cough that persists for several days to weeks, increased mucus production from the lungs. This is thicker than normal and may be discolored, yellowish gray, green, rarely blood-streaked. Fatigue, chest tightness or discomfort, shortness of breath. Bronchitis is not usually accompanied by a fever. If you have a fever, you may have pneumonia or the flu instead. Bronchitis can develop into pneumonia in some people. Bronchitis may be described as acute or chronic. Acute bronchitis usually follows a cold or the flu and symptoms usually get better within a week, although you may be left with a cough that lingers for several weeks. If your cough lasts for at least 3 months and you get recurring bouts of bronchitis over a period of 2 years, it is referred to as chronic bronchitis. Chronic bronchitis is often due to smoking and is one of the conditions included in chronic obstructive pulmonary disease (COPD). Diagnosis of bronchitis. See a doctor if your cough lasts more than 3 weeks, is accompanied by a fever, is blood-tinged, or associated with wheezing or shortness of breath. Your doctor will perform a physical exam and listen to your lungs as you breathe with a stethoscope. A chest X-ray, sputum tests, or pulmonary function tests may also be conducted to help with the diagnosis. Treatment of bronchitis. Bronchitis is most often caused by viruses, so antibiotics will not help treat the condition. Most cases of acute bronchitis get better by themselves without treatment within a couple of weeks. Cough medications may help with sleep at night, and people with other conditions, such as asthma or COPD, may benefit from bronchodilators and corticosteroids to open up their airways and reduce inflammation. People with chronic bronchitis may benefit from pulmonary rehabilitation. This is where a respiratory therapist teaches you exercises to help you breathe more easily and increase your ability to partake in physical activity. Non-pharmacological treatments can also help you feel better, such as warm lemon and honey drinks. Humidifiers, these produce warm moist air which loosens mucus in the airway, allowing you to cough it up easier. wearing a mask or a buff over your mouth outside if you are exposed to cold air, smoke, fumes, or other pollutants. Drugs used to treat bronchitis. The following list of medications are in some way related to, or used in the treatment of this condition. Generic name, azithromycin systemic. Drug class, macrolides. For consumers, dosage, interactions, side effects.